Hello, this is week 5 of our semester. This week we're going to be discussing healthcare disparities and gynecology versus urology. And when we talk about healthcare disparities, I wanted to talk about primarily the main reason why we have this topic is because women are less likely to have their their symptoms assessed properly. One of the big reasons for that is because as we were learning how women are, the adjectives that we go to describe women, they're emotional or whatever like that. And they also, all those soft adjectives that we describe them, emotional, irrational, or whatever. They're not as strong as women, or as the men are. Sorry about that. Anyway, so they're less likely to have their pain assessed. And what happens is sometimes because they don't have their pain properly assessed, they get sent home from the doctor's office or they don't get any actual diagnosis. And so they'll go on and suffer until they go back and say, I was here before and the problem is persisting and I need to actually have someone help me right now. And there's something wrong. I feel like there's something wrong. And I know this happens because my mother, who was a woman who didn't speak English very well, and she would go to the doctor, and because they didn't understand her because of the language barrier, she was often not diagnosed, and she was told that it's in her mind, or she's, it's just imagining it, or it's just stress or anxiety, some sort of fake diagnosis, if you will, to just let them know that there's nothing really going on, they just are stressed out. And so when we think about things like this, we have to wonder, does a man go into the doctor's office and says, I've got this pain that's been been here for about 2 or 3 days, doc, and it's kind of like shooting or throbbing or whatever, and they're describing their symptoms? They get assessed, they get examined, and they come up with some sort of diagnosis. Whereas most of the times, not most times, frequently enough though, women don't get that type of consideration. Men are more stoic in their pain as well, but they also will go to the doctor and be taken seriously. Women are also more likely to be diagnosed with mental health disorders, or mental conditions, and they say that they're more hormonal. So they might say, well, you're being stressed out, or you have anxiety, or you're depressed, when possibly none of those issues or none of those diagnoses are actually real. But because they sometimes don't understand the doctors may not understand what the problem is, that's a way that they can diagnose them to kind of say, oh, okay, well, I shouldn't be worried. Okay, this will pass. And sometimes it doesn't pass, okay? The other thing I want you to understand, and it's more important, really important, is they have lack of control over their reproductive health. When I talk about reproductive health, I'm not actually talking about birth control or the lack of birth control or access to birth control, although that is a problem. I'm talking about sometimes they will have painful menstrual cycles, and they may have abdominal pain, and those are all dismissed as, oh, well, those are just normal pains that you would feel as you go through a menstrual cycle. Sometimes it can be what they call painful periods, right? Oh, sometimes your periods can be painful, when the underlying condition may be something more serious. But you have to understand, most doctors are male, and several doctors who are gynecologists are also male. It's not a fact that every gynecologist is a female. And I always found that kind of interesting, that a doctor who is going to be treating female issues doesn't understand female issues as far as how they actually feel in their body, because they don't have the parts. Yet they're going to tell them this is normal or whatever. They just know from what they learned, of course. But to actually experience it is a different thing. And so that's why there's more gynecologists are becoming female now, and more women are preferring female gynecologists for that reason. okay? You also have to understand that when there are transgender individuals, more about transgender in the semester, but there are transgender individuals who have to go see a urologist or a gynecologist. If the person is once biologically female and they are now transitioning and they are posing or passing as male, they still have anatomical parts that are female, like a uterus and ovaries, okay? Although the hormones that they may be on are not actively making those organs produce an egg and menstruate, that kind of is paused when they're on this hormone replacement therapy. But that doesn't mean that they shouldn't see a gynecologist to make sure that nothing's going wrong there. Like there's no growth happening in the uterus or the ovaries are okay, because they can still get ovarian cancer or uterine cancer. So they have to go in and have their actual annual exam. Even though they presenting as male, they still have female internal organs. Same thing for those who were once born as male who have transitioned to female. They still need to see a urologist because they have internal organs, sex organs that are still there, okay? Such as the testicles or the prostate. And we know that there's testicular cancer and we know that there's prostate cancer. And just because they're posing or passing as one sex or the other does not necessarily mean they need to not see the proper healthcare professional like a gynecologist or a urologist. They do have to see those. But what happens is sometimes, not always, some doctors or even the staff in the doctor's office are not very in tune to transgender identities, and they can make fun of them or disrespect them. And when that happens, they tend to just choose not to go and get treated, which is not an answer either. And so we need to train our healthcare professionals to keep their biases in check or not to present their biases, because they have to remember that they are a professional first and foremost, regardless of what they might think about transgender or LGBTQ issues. And if that can be kept in check, then the people who need the care can get the care, and they don't have to worry about going to get the care and putting it off. Because we all know, hopefully, that if you don't get checked properly and frequently or on a regular basis, things can happen. And sometimes we don't know things are happening until the pain or the physical appearance is there. And all too often, that may be the point of no return, so to speak. But if we can catch it early enough, we can deal with it and we can fix it. And that's why it's so important to get the proper care when you need it before anything is a problem. But with the way women are often treated and disrespected, many women will avoid treatment, which is bad, okay? So we have to remember doctors have biases, okay? And that can happen. So if you have a doctor who does treat you with disrespect or has his own bias, regardless if it's LGBT or not, you want to get a second opinion or you want to change doctors. We're going to talk a little bit about hormone replacement therapy, but more about that when we talk later on transgender. But because this is a medical thing, sometimes hormone replacement therapy isn't always for transgender people, okay? There are men and women whose bodies is not producing the correct number or the correct amount of estrogen, women, or testosterone, men. So they need to go on hormone replacement therapies so that their bodies can be in balance or correctly working and functioning, okay? But the problem is sometimes when they have those lower hormone numbers, there's not always the consideration like, well, let's check your hormones to see if that's correct, because sometimes the symptoms are very similar to others, like fatigue, weight loss, depression perhaps, and they can be misdiagnosed. And so the patient needs to say, but doctor, this just came on and I don't believe it's that. And I was doing some research online or whatever, and I think my estrogen levels may be low, or my testosterone levels may be low, or whatever it is. Can we at least do a check on that? Okay. So sometimes the patient has to be their own advocate because the doctor isn't always the one that knows what's going on with your body. And that's pretty much what I want to talk about this week about healthcare disparities, or gynecology versus urology. So the things that I want you to keep in mind when you're doing your own research or considering the prompt for the discussion board is to think about gender bias in terms of healthcare. Gender bias can be several things, but think about that in terms of healthcare. Think about the social roles and biases. What do people think about when they see male or when they see female? What do they think about, and what are their thoughts on healthcare, on men versus women? Research those topics. And research bias as far as male versus female health disparities. And what are some of the treatments and diagnoses? Are they always accurate, or are they sometimes misdiagnosed or mistreated, so to speak? Okay, and that's what I have for this week. And of course, if you have any questions, I am always available. So have a great week. Thank you.